988 is more than a number. It is a message. It says, we're there for you.
When you are dealing with trauma, you have to look at this situation as a fire, and you want to put it out quickly, but sometimes you just have to come in the room with them and kind of guide them out.
When someone calls 988, I think that they can expect to find someone who's wanting to hear their story, who's willing to take the time to listen to them wherever they're at and encourage them to talk about, things that they may not feel comfortable talking about with someone else. We don't give advice, but we do support the search for those solutions on your own, and really just giving someone the space to explore options and know that they do have options to find help and that the help is available and people are willing to give it.
Knowing that someone is there just to listen makes a huge difference in their lives. In the mental health context, crisis care is aimed at providing in-the-moment support for individuals to manage their psychological distress and their mental health emergencies. It can include suicidal ideation, self-harm. It can include panic attacks, severe anxiety or depression. It can include overwhelming feelings of sadness or hopelessness and ongoing worry. And it can also include psychotic episodes. Crisis care to me is communication. That is where everything starts.
When someone calls our 988 Crisis Lifeline, it really is just, hi, hello, you've reached the 988 Crisis Lifeline. How can I help you today? And so it really is about the support in the moment. And oftentimes people aren't aware, but you can call 988 just for information, just for resources.
People can contact 988 for any reason they could possibly think of. I have encouraged people to call us if they don't really know what we do, right? It's a chance to kind of make a practice run, to have a conversation, to say, what kind of questions can I ask you? They can call to get education about how to help someone that they care about that's in crisis. Some people will call because they're struggling with basic personal needs, like paying their rent, or they're unsure where to sleep tonight, or it's hot outside and I don't know where to go to find somewhere cool. If we don't have the answer, chances are with our team working together, we're able to at least get them connected to somebody who would be able to help with meeting needs.
You can call 988 and get advice on how to speak to your loved one who might be struggling with anxiety or depression or substance use. Not everyone calling 988 is in an urgent, emergent state of crisis. In fact, the majority of the calls coming in really are that information, that connection to care. And I think that that's important because we don't want you to wait until you're at the crisis state of where you're wanting to kill yourself or where you feel like there is no hope. Call us before. We are here to help you walk on that recovery path and really, in the moment, get you connected to those ongoing services.
We will make sure that you get something. We will set it up, we will figure it out, we will create something if we have to make sure that they are all getting the services that they need.
I think the thing about crisis work that matters the most is anyone can find themselves in crisis at any given time. We have these skills that we have built up over life, and then one day they just don't work.
It's our obligation, it is our responsibility ethically to provide accessibility, because we can't cherry pick who we provide support to. Crisis-like care it needs to be and should be an all or nothing approach.
988 really has been more than just that suicide lifeline or the mental health lifeline. We've really wanted to make sure that we're addressing substance use as well. And so our behavioral health crisis centers are very critical for those folks who are currently actively under the influence. It is not uncommon that someone will call our Compass 988 Crisis Lifeline and we're able to get them connected to a behavioral health crisis center within a matter of moments. We have our mobile crisis staff go out, get them and take them to the location and actually help them go through that withdrawal process.
With substance abuse, there's so many opportunities to seek treatment. You know, we have the 12-step programs, or there's inpatient treatment. There's opportunities to look through harm reduction. And one of the beauties of 98 is that we have talked about those in a lot of cases, and so we've done the research already, and so it takes a little bit of the pressure off of the person who's seeking help, because we can be there with them throughout the process to find a little more information.
Really wish that I had something like this, you know, to be able to understand environments, you know, and understand that because we're in a place, we don't have to stay there. One of our greatest things that we have in common is our lived experience and our stories. So as we share in mental health and substance use stories with other people, depending on their situation, you want to show them that you are available, number one, and you're a living proof that this thing does work, that we do recover.
There's been a lot of conversation about 98 and making sure that it's accessible. Just the transition from the original Lifeline phone number to 98 makes it easier to remember and easier to make contact with. There's been a lot of prevalence in the schools and in places where youth are going to see that 988 is available for them. And so I think that just making it easier to find that care has been important.
They say that the age most people have mental breaks are during high school to college days, like anywhere between, I think it's like 17 to 25, somewhere that mental health starts really kicking in. I think catching them at early ages and talking about what has happened and not stopping them from their experiences and letting them have what they think it was, regardless of how we feel it should be. And children don't have that space anymore. Like, it's always somebody telling them what we used to do, how we're gonna do it. We're talking about things that happened in 1960s and 70s and 80s. And these children are not able to really express themselves, and the only attention they get is when it's received negatively.
We really want to help educate not just our students and not just the teachers, but like coaches, parents, about the resources that they have accessible to them 24/7. So our 988 task force and our Missouri Suicide Prevention Schools Committee really dug in deep to create a 988 virtual resource guide. And so it's really able to assist folks with videos, with links on every step of the process and who to contact and what's the resource in your county, who's the contact person in your city. We also added what are called youth behavioral health liaisons. We now have 38 in the state of Missouri that are really tasked with going and creating and making these relationships with school systems to make them aware of all the resources that are accessible in our behavioral health field to our youth.
Asking them questions, truly listening to the answers, and trying to incorporate their wishes and their goals into our safety planning and into the conversations that we have. I like to give youth the opportunity to lead conversations with trusted adults, role-playing with them how that conversation might go, and empowering them to have that conversation independently.
The best way that we've learned to reach youth is by bringing the youth to the table. And so we've had a lot of youth focus groups where we're really just listening to them, making sure the material we create is something they will look at.
There's options for you to tell people. Don't keep those bad thoughts in your head. Tell somebody, or like a loved one or a friend, they can help you.
I had someone to talk to and someone I can reach out to. I just learned how to talk for myself and not have other people talking for me.
The warning signs that appear in youth that may be different than adults is that it's probably going to be a lot more nonverbal cues. It's going to be a lot more changing in behavior patterns. It might result in them being more angry or not taking a shower or not caring about their appearance anymore. Sleeping more, sleeping less. It's not necessarily something that they're going to verbalize, so I would really look at the nonverbal cues as huge warning signs.
The needs of many outweigh the needs of few. And I don't believe that. I believe that the needs of everyone should be valued and important.
Accessibility is so important. If we don't have accessible services, then it doesn't matter how good those services are if people can't utilize them. You can literally text the digits 988 to get a hold of us, to get a hold of a trained crisis counselor who goes through the same amount of training a 988 counselor who's answering the phone, or a 988 counselor who's answering the video phone. The training, the requirements, the standards that we hold everyone to are the same. Point of having chat and text, it is not a substitute. It is not like a Band-Aid for people who can't use the phone. It is another avenue to be accessible, to be inclusive. Text and chat is a very popular way for it to communicate in the real world. It's our responsibility as the people providing help and support to adjust to that. And that's what makes chat and text such a pivotal and necessary piece of crisis care.
When it comes to improving mental health care, the next important steps I think we need to look at is making sure that we continue to improve accessibility. The Crisis Line specifically provides access to so many communities and so many people who are struggling, who don't have that standard access of walking in for an appointment or opening the door and walking into care. The Crisis Line touches everyone across the nation, and with the backup center network that we have, it ensures that people are going to get the care that they need as quickly as possible. Making sure that we're continuing to talk about the crisis that people are going to, and that we're talking about suicide and that we're saying the word, and making sure that people know that it's okay to experience these thoughts. They're not the only one experiencing it, and there is help available.
Deaf Lead is a national backup center for chat and text. We are also in the state of Missouri solely chat and text, and we provide the 988. Deaf Lead's mission is to provide the deaf community culturally and linguistically access for crisis services 24/7, 365. When we think about equal services, equitable services, right? We think, oh, access for everyone. And that's not the case. We need equity, right? So distributing resources for the users in an appropriate way. That's equity. So the 988 video phone is a recognition and a demonstration of that, providing the resources for equity for the deaf community.
Crisis care over the phone or in person. And again, I would say it's not that it's not a matter of effectiveness, it's different. It is not everybody wants to communicate the same way. We see younger and younger generations, they don't like talking on the phone.
When I was 12 years old, I contacted a crisis line. It was just awesome. It was awesome. I was very frustrated with my parents. They were making me crazy, and I was feeling depressed, and I was having a hard time at school at the time. And so I reached out, and let me tell you, it was so helpful. And now as an adult, I have the opportunity to provide 988 video phone. And that is just incredible. I mean, from my 12-year-old self, moving forward to my 50-year-old self and how that impacted me, it's just, wow. I want to let everybody in the deaf community know that 988 video phone is here. Come on, bring it on, use the services. We are so thrilled and excited.
One of the things with Provident Behavioral Health is that we've been active in St. Louis for over 150 years, and so we have many programs like counseling or psychiatric nurse practitioners and behavioral health specialists that are working in schools. So obviously we have that connection internally, but we also work to keep a big database of local resources and national resources because we do work as a backup center for Lifeline across the nation. We have to be prepared to find those resources in Wichita, Kansas, or Jacksonville, Florida, wherever the case might be. And so our team works day and night to make sure that we're constantly adding resources and making sure they're up to date and that they're the appropriate resources for our callers.
You know, I think we have definitely made great strides in Missouri on improving our behavioral health system. I think the more that we can start to integrate and look at the bigger picture of how people access resources, the better off that we will be. So really continuing to work with our primary care providers, continuing to work with our dental, our school systems to make sure that every access point that a human can come into contact with has a general idea of how to get them connected to where they need to get the resources and help. I think the more that we can generalize behavioral health into healthcare at large, the better off and the greater progress we will have in the end to really do what we want to do, and that's get people the help that they need before it's too late.
988 is a 3-digit number for anyone facing mental health, suicide, or substance use crisis, or if you are concerned about someone else. It's called a Suicide and Crisis Lifeline, but crisis means different things to different people, and as the prior speaker indicated, you don't have to wait for it to get bad enough. If it's a crisis for you, it's a crisis and you should seek help.
I can tell you that in the last 2 years, we've committed almost $30 million to 988, and that's how important it is to us. As my role as Lieutenant Governor, and all Lieutenant Governors before me, we are also the advocate for our state's veterans. And I can tell you, veterans crisis is incredible in this country as well. We lose 22 veterans a day to suicide. In Missouri, we have established evidence-based care continuum with 988 at its core, ensuring responsive crisis service accessible to anyone in crisis, anytime they need it, anywhere they in the state. Missouri is recognized as one of the top 10 states in the nation for call and response to calls and texts, and I can tell you that we've answered over 51,000 calls and 6,200 texts and 8,100 chats. That's a lot of people who are reaching out in crisis. There's always people out there looking for somebody they can talk to, looking for that help, looking for somebody that tells them they love them and care about them, and 988 has made such a difference.
It might be called the Suicide and Crisis Lifeline, but what the counselors who staff these centers actually do is empower people when they are most in need. The Biden administration last year boosted federal investments in the Lifeline by 18-fold, from $24 million to $432 million. This was done simply because it was needed in this country. The Crisis Lifeline was undertaken to address the rapidly rising suicide rate, particularly among Black teenagers, Native Americans, Latinos, and residents of rural areas. From 2010 to 2020, the suicide rate rose 43% among Blacks.
Suicide among Black Americans primarily hits those under the age 35. The group with the highest risk, those 20 to 24. Males account for 80% of those suicides. Doesn't mean sisters are not at risk, but I'm telling you, this 988 is a lifesaver. Don't leave here without realizing that your knowledge about 988 can save a life. How you get Black Americans to engage in mental health care? You make sure it's effective. You make sure that's available. And 988 brings a new capacity to make sure things are available.
The new Crisis Lifeline, a simple 3-digit number, has been a resounding success. Kaiser Family Foundation study found that the nationwide number of calls, texts, and chats in the first full month of operation jumped by 45% compared with calls to the old suicide prevention hotline.
Missouri is handling 4,000 to 5,000 988 calls every single month. That's on top of the other crisis system that we laid 988 on top of, the Access Crisis Intervention System. So those calls are still coming in as well. So we more than doubled, if not tripled, our call volume when 988 went live. One of the things that's absolutely key is that we normalize help seeking. And what we used to have to tell people is, oh, well, we need to find out which crisis line you're going to call, what local area are you, what county are you in, what jurisdiction are you in. Yet there was this Rubik's Cube of which number this person needed to call. Now at a national level, we can literally just tell people, call 988, text 988, go to the website and chat to 988. So that improved accessibility has increased our volume quite a bit. More people are calling, and one of the things that we're seeing particularly is we're seeing younger folks calling, which is a really big deal. That's helpful. And one of the things that 988 really does at its heart, whether it's text or chat or phone, is it says your life is worth living. Your life matters. It's worth it.
988 came at a great time in Missouri. We've actually been building out our crisis continuum over the past 10 years, and we launched community behavioral health liaisons and coordinated a statewide coordinated CIT response with law enforcement over 10 years ago. In the last few years, we've also developed behavioral health crisis centers, which are places folks can go. And we have strengthened our mobile crisis response. So 988 really binds all of that together and has helped us really, put the cherry on top of a much more rich crisis continuum. What's important about that is that all those places and positions I described are part of an integrated behavioral health care system. So the folks who are employing those helping professionals, whether it's the 988 call centers or the mobile crisis responders, they are working at our treatment providers. So we are the closest we've ever been, I believe, to a no wrong door system to mental health care. And so I think it is very important to have fewer handoffs. If a person calls in crisis, the less they get handed from party to party, it makes it easier. So as integrated as our system can become, I think that promotes the best outcomes. Workforce is a 4-letter word across the nation. I'm not gonna lie, this is a tough problem, simply because we have a shortage of workers in every field. But there are steps that we've been taking, and one of those things is making sure that we make use of all types of helping professionals. We don't focus solely on those who have a behavioral health license. It takes all sorts of folks. We've heard from peers. That's an incredibly important resource in the field of mental health and behavioral health. And so we want to make sure that we've got folks who are interested and passionate have the right training to be able to deliver an array of services.
So I'm part of the LGBTQ+ community. I'm also disabled, and I'm Cuban American. I'm first gen. And growing up in Miami, you don't really see a lot of people like me. And if there were, a lot of people always kept quiet about their identity. And so in order to hide myself, in order to pretend to be strong, it's very easy to lose yourself in that. And so as a result, I struggled a lot with mental illness. I was diagnosed with depression and anxiety very early on, something that you don't really want your child to go through. And despite my parents not really seeing eye to eye on the LGBTQ+ identity, they did realize that they never wanted to see their child get hurt. It's very easy to lose yourself in acting strong. And when you don't really see people like yourself, you don't feel like there's help for you. You don't feel like there's anything out there that can help you. And so I feel like with the upgrade of 988 from the original number and the changes that are being made, it's really important to reach out to communities that might not know about the number, just to be able to share that there is someone or something out there that will make that weight off their shoulders much lighter.
I think my passion to do this work really comes from, when I was young, I worked out at the Chiefs Stadium in Kansas City, and that is an environment that has all sorts of human behaviors and interactions. And I was doing security and crowd control, and this gentleman had a gun to his head, and no one did anything. There was so many people in that crowd, and no one said anything to him. And so I stepped out and started to talk to him. I'm a teenager, and I'm just asking him, it's okay, man, it's all right. And that changed and saved his life. And I know that that's a strong example, but I do feel like it's a normal example. We have neighbors that we don't even know anymore. And so I really just want to, educate our communities to know it's okay to not be okay. And ask somebody, make eye contact.
I was someone who struggled with depression as early as college, didn't understand what that was, did not know who to go to. And then several years later, I had an experience where I made an attempt on my own life. And thank God for algorithms and searching ways to die, that something popped up in my timeline with a phone number. And in the middle of the night after that unsuccessful attempt, I made that call. And that person talked with me for 2 hours. And I thought, man, they will never understand what I'm going through. And that person prayed with me. She wasn't a Christian, but she knew I needed that support. So you're dealing with a plethora of things that are going on, and I'm here to tell you, I'm validating your experience right now. It's real. And we're talking about 988. I didn't have that. It is a stigma that we do not talk about our mental health. It makes us weak, right? There are people on the other, and I know some of them personally, who are on the other end that are working their butts off to ensure that you get the support that you need. Culturally competent support, meaning they not only understand race, but they're starting to understand cultural differences and some of the pressures that you're facing.
It's essential to acknowledge the importance of delivering comprehensive crisis care that caters to the diverse needs of all people. We've saved so many lives, and we're going to save many more. Since launching in July 2022, the 988 Lifeline has received more than 5.5 million calls, texts, and chats for people looking for help with thoughts of suicide, mental health crises, or substance use-related crises. Our efforts have significantly improved answer rates and reduced call transfers, expanding access and ensuring quicker aid for those that are in need of help. This success follows a nearly $1 billion investment by the Biden-Harris administration. We have recently launched Spanish text and chat, and that was another important step to ensuring that the Lifeline is accessible to who all need it. American Sign Language services are now available for deaf and hard of hearing community at the 988 Suicide and Crisis Lifeline.
People need to be served in their own language, and people need to be able to receive culturally appropriate care in the language of their choice when they are in crisis. One thing about 988 is that we have 215 crisis centers across the country, and we offer support 24/7. So it's important folks can know that they can reach out to us at any time. We at 988 are providing hope, right? We are tearing down a barrier of communication so that folks who are deaf and hard of hearing can use our services. 15% of Americans struggle with their hearing, and folks don't like to talk about it. And so what we want people to know is that we're here for you.
We still struggle with our own stuff every day, but we just trying to show each other that we don't gotta struggle alone. It's okay not to be okay. And we don't have to fight our storms alone, and we can fight them together. And so I just encourage people to not suffer in silence. If something going on, talk about it. Share your story, like your story is powerful.
I've spent the last 5 years either burying a brother or reaching out to help save a brother. And these are CEOs and very successful men because they are going through emotional and behavioral health crisis. Some are even suicidal. So for all of you, I'm just telling you, pay attention to this small thing. The fact that you might reach out and just ask someone how they're doing, and if you hear they're not doing well and say, I don't know what to do, put them in touch with someone who might. And it's as simple as 988.
If you are struggling and thinking about calling us or reaching out to us, do it. Don't wait for it to get worse. You don't have to question whether or not it's bad enough to reach out. And no matter where you live or what your circumstances, you have access to mental health services. If you are feeling lonely, if you're feeling isolated, and feel that there's a barrier to accessible support, we at 988 are here to help, no matter what.
We want to continue to make sure that every person that lives in a United States state, a territory, a tribe, knows that this service exists. And so the more we can be in spaces where we can talk about this, where we can tell a friend, we can tell a family member, you may end up being in a position where you're saving somebody's life. You may be the lifesaver.
Text 988. There are people on the other, and I know some of them personally, who are on the other end that are working their butts off to ensure that you get the support that you need. Culturally competent support, meaning they not only understand race, but they're starting to understand cultural differences and some of the pressures that you're facing.
Break down the silos. Really understand that it takes a community of folks to make this work. Call 988. We're here. We will respond. We're bridging the gap, but it's going to take all of us collectively to join arms and walk this journey together.
You have struggled before, and you sought help, and you got better. Tell that story. Please, tell that story. There are so many of us that are struggling, and we're so afraid to reach out for so many good reasons. And when other people have reached out and had a good impact, it's changed their life. When you tell that story, you save lives. That's life-saving.
There's always someone you can talk to. You know, find that adult, find that person that's there for you, whether it be a family member or 988. Just talk to somebody.
Is that it is very normal to have those thoughts and those feelings. It is absolutely okay to not be okay. Because oftentimes, as their loved one, it's not you. And that's okay. They may need that third-party individual to provide them the support and the openness to really share their story without that judgment or fear.
Crises are temporary. Crises are time limited. And that reaching out for help can be sometimes more terrifying than the crisis itself. But when you're ready to do that, we are here to support you in whatever way we can.
Do not be afraid to reach out.
Simply remember that your mental health is just important as your physical health. Just because you are struggling mentally, that does not make you weak.
Be audacious. Be audacious about your mental health. That means being bold. Forget the past. Be bolder in it.
Trusting someone is the bravest thing you can do. Reaching out is going to be the hardest thing throughout the entire process, and once you do, things will definitely smooth over.
Know the number before you need the number. We're not waiting until someone's house is burning down to tell them about how you can call 911 to engage with the fire department. So having that knowledge so that if you find yourself struggling, you already know where it is that you can reach out for support, or if you find that you have someone else in your life who is really struggling, who maybe isn't at that stage where they're willing to talk to you, you can point them in the right direction for where they can get that support and access.
Give us a chance. Before you make that decision that you can't walk back from, please give us a chance. So please call, see if there is something that we can do for you.
You're not alone. Someone is waiting for you to pick up the phone and to reach out for help. It may be scary, but you're not the first one to do it. And just the fact that you are making that first step means that you're strong enough to do it yourself.
It's okay not to be okay. Find a safe place to talk to someone.
You are not alone. Reach out. Come on. Keep fighting. You are worth it.